Call the meeting to order.
You all set with that hearing device?
Yeah.
So before we jumped into the agenda, we have a couple of people that wanted to say something. The items are not necessarily on the agenda, potentially, but I thought could give them a couple of minutes.
Sure.
Maybe we could do that now, and if there's no objection to the board.
No, that would be fine. Those folks there.
I believe it's Ms. Michaud. If you wouldn't mind stating your name.
My name is Tiffany Michaud. I live on Townsend Street in Fitchburg.
If you wouldn't mind stepping up to the microphone, because it is on television, so.
Great, perfect. So we're here for a mask mandate repeal. You've touched your mask over 23 times already, and you've over 11. So that's the, maybe 5 minutes I've been in this room. So there's cross-contamination going on. You're wearing masks in school. That's doing nothing. You're basically stopping mosquitoes with a chain link fence. The virus goes right through the mask. The particulates are smaller than the holes in your paper. If the virus was that bad, we'd all be wearing respirators, okay? There's no need for the masks. I've been everywhere. My children have been everywhere. Everybody else's children go everywhere. Nobody needs the masks on until they get to school. I'm sorry, it's ridiculous. I'm also here because I'm in opposition to the required testing in our public school for after-school activities. Okay? So I was told it was a privilege by the superintendent. DESE laws and regulations protect children's privileges for after-school activities. And obligation for those protections to discrimination is not obviated or alleviated by any local law, rule, or regulation by any organization, club, athletic, or league, or association that would limit the eligibility or participation of any student.
I'm sorry, could you go back to the microphone?
Yeah,
I'm sorry.
We're all in
having
the same room,
trouble
okay?
hearing.
Because I can't stand with this in front of me. I'm short. So maybe you should get me something to stand on. I don't know. So as part of the admissions
Do you have any
process, you
objections
cannot limit you cannot use testing as a limit.
Do you have any objection to using these?
Testing cannot be a limit to after-school activities. No materials, tests, or procedures shall be employed for guidance purposes to discriminate or limit choices of these students to participate in these activities. It's discrimination on the basis of a medical test, a test that has not been FDA approved. It's authorization use only, okay? I would like to have a meeting about this. I will send in a letter. The PCR tests were never designed to detect pathogens and is 100% faulty at 35 cycles. All the PCR tests overseen by the CDC are set at 37 to 45 cycles. The CDC admits that any tests over 28 cycles are not admissible for a positive, reliable result. This alone invalidates over 90% of the alleged COVID cases infections tracked by the use of the faulty testing.
Excuse me, can I ask you a question, or do you want me to wait until the end till you're through?
Go ahead.
What do you, I wouldn't know what you mean by cycle. I've never heard that term before.
That's the amount of rotations they use to amplify the virus.
Okay. I'm not a lab tech, so I don't.
Yeah, me either. Okay? So it violates the Constitution. These children are protected by the Constitution. Their privileges are protected. A privilege of school is protected. So you got DESE that you're violating. You got the Constitution that you're violating. You got the civil rights that you're violating, the Nuremberg Code, where you shouldn't be using coercion or force to get these children to test for a test that is not approved. You want to wear a mask, you wear a mask. You want your children to be tested, you want to be tested, go ahead. All of these children should not be forced to take a test. In the classroom is where this is happening. In the classroom, there are privacy laws. Can't check for lice in a classroom. You're testing these kids in the classroom.
You're talking about the after-school program, not test and stay.
You're testing in school for the school program in the classrooms. In the classrooms.
It's my understanding that they're doing it in the nurse's office.
Your understanding is incorrect.
Well, my daughter works for one of the
Well,
schools.
my children go to the schools, my nephew and niece go to the schools, and I have other family members and their children come in and they tell me, my daughter's classroom, they do it in the back of the class. Her friend's classroom, he was just at my house. He tells me they do it in the doorway.
Maybe they do that to provide social distancing. If
Social
the child is-
distancing, segregation. Okay, we're treating these schools as an infectious disease unit. Masking, testing, they're not sick kids.
And we don't
Okay.
want them to be sick.
Listen, this is not a hospital. These are schools. You're supposed to be educating them.
Could I just interrupt? How many children do you have in the schools?
I have two.
Two? And what ages are they?
They're in 7th and 8th grade.
Okay, and which school are they in?
Is it relevant?
I'm just curious, yes.
They go to McKay.
Okay,
My nephew and niece, they go to Long's Joe. Okay? So, I'd like a meeting about this. I'll write a petition for whatever I need to do to get it. But, you guys are worried about health and safety. Why don't we start with washing hands, because it's not happening in the schools. I've been saying this for years, it's not just now. You got $31 million.
Did this to the school
Go-
nurses? To the-
Excuse me?
To the nurse leader? Have you talked to the nurse leader about this? About washing hands?
About what?
I mean, how do we know they're not washing
They-
hands?
They cannot wash their hands. The teachers have told the students, there's not enough time in the day for you to wash your hands before lunch. This has been going on forever. Because I've had a concern with this forever, and we're wearing masks, you want them to test all the time, that, you know, all this stuff is going on, and nobody's washing hands. So they sell Bradley Classic stainless steel wash fountains, such as the ones that are in Monty Tech, where multiple children can wash their hands at one time. Maybe we should purchase some of them. That's the number one thing in infection control, is hand washing.
it is important,
It
no
is very
question.
important.
Yep.
Testing children that are healthy and having them go to school as if they're on a unit in a hospital where everyone's infectious. Why are we suspecting that everyone's infected?
Well, the
please say
problem
that,
is we don't know who is infected and who's not. That's why
Right,
the
so
testing.
you're searching for a virus. It's so bad you have to test everyone to find out if they have it. Thank you. It's total baloney. It is. It's 100% trash, if you ask me. Okay, so you're discriminating and segregating children because they're not tested, and I am 100% opposed to it. Some of these children, their after-school activities is all that they have. You're taking it away from them based on a medical test that is not approved.
We're not taking it away from them.
No, you are. They're required to take this test or they cannot participate in an after-school activity, which is on school grounds, which is at the school, which is protected by our DESE laws and regulations. 100% protected.
Well, we're just asking them to
It's
participate.
discrimination and segregation based on an unapproved medical test.
There's no
It is. You're
discrimination.
discriminating against the untested. It is. You can say no, but it is. It's an unapproved test. It's authorized for emergency use only because they have nothing else to determine it or to amplify something that clearly I'm in a room with all of you people you
Let me
find.
ask you this then. Why are we testing everyone coming off an airplane from a foreign country?
I didn't get tested.
You will be next time.
Yeah, well, we'll see how long that lasts. But
No, you will be next time.
we'll see. This is a school setting. It shouldn't be treated like a hospital. You're affecting these children's mental health. It's absurd. How many times have you touched your mask and you've touched your mask? I'm sorry, I have nothing against you, but you're touching it, you're touching it, you're touching everything else, you're touching it, you're touching it, you take it off, you eat. Well, you can't wash your hands, so not enough time in the day for that. Sorry. Hand sanitizer, you want to eat it? Yeah, it's not bad for you once in a while, a little bit, but when you're doing it every single day,
May I ask a question?
when you're doing it every single day, you're ingesting that every day, that's good? It's not good. It's not good for anybody.
May I ask a question?
Go ahead, ask your question.
Are you aware of how many positive confirmed cases there are in schools?
No. Actually, I saw Sam posted it, our totals, and we've had like over 5,000 cases since 2020.
Are you aware that extracurricular activities in some schools across the state have been canceled due to COVID?
I think we should just, you know what, it's a virus. It's not going away. It's not. It's going to mutate and mutate and mutate.
That's not the
and
question.
mutate, just like the flu, okay? So we need to learn to live with it and stop doing these things to these children. It's awful. And if you don't see that it's awful, maybe you should go to the schools and you should talk to some of these children because it's disturbing on what they have to say.
Well, we understand, and it's hard on everyone, but I think that what we're trying to do is to keep everyone safe. And
Okay, I get it. But this is an education system, it's a school. They're there to educate. They're not there to treat it like an institution where everybody's infected. I'm sorry.
Last year, the kids were studying remotely. This year, at least they're in the schoolrooms, in the classrooms.
Okay. That's
Why
a
are you
whole
laughing?
other meeting about the educational system and what they're learning, because that's a whole nother thing.
We're trying to keep them in the classrooms.
Right, they don't need masks. If you're sick, you stay home. Just like any other virus, I'm sorry. It's gonna mutate and mutate, and they got another one coming. Guys, it's another common cold. You're gonna be all right.
It's not a
Or
common
you're not,
cold.
just like anything else. Some people make it, some people don't. I'm sorry.
have your children been vaccinated?
That's none of your concern.
Sorry?
It's not your concern. That's not for you to be asking me that. It's private information.
No, it's
All
not.
right, don't give it to us if you don't want.
Okay,
So it's good public health not to know if the virus is in the schools.
you have to search for a virus. You're searching every child for a virus that they
So
have to.
it's better to react.
Amplify
It's
the
better
amount
to
of
react
viral
than
load
be-
in the test to find out what it is. Come on,
It's better to react.
give me a break. All right. So, okay. Thank you for all of your time and your patience.
Thank you.
And your understanding. And hopefully, I'm hoping that it gets through to some of you. I just have one more thing to say. 2 days ago, I had a conversation with you on the telephone, and your question about my body anatomy and my private bathroom matters are none of your business.
I'm not sure what you're referring to, ma'am.
It was inappropriate.
I wasn't
rude,
able to
belittling,
answer
and it
many
was
of your
harassment,
questions.
and I do not appreciate it,
Very
sir.
similar to this situation where I was not able to answer any of your questions. You
Yes,
had another
so
10 questions,
you-
just like you're doing right now.
So you resort to degrading me.
I did not resort to
did.
anything, ma'am. You didn't allow me to answer, and you assumed what my answers are.
I didn't assume what your answer was.
Yes, you did.
I told you that the test was invasive, which it is. It enters your child's body.
And I said
You
what?
said.
And I said, I
Is
understand.
it invasive when you wipe your butt?
That's not what I said,
That's
ma'am.
not
I
your
said-
business. You do not say that to a
I think
constituent.
we've had enough of this. You said,
Have a good day.
Am I going to be allowed to finish? I said, I understand and I accept your opinion. I respectfully disagree with it. I said, is it a medical procedure to stick a Q-tip in your ear to clean your ear? Is it a medical procedure, or is there an issue with wiping yourself when you go to the bathroom? It's,
That isn't invasive
made the
when you
argument
wipe
that
yourself.
Again, I can't finish.
Have a good day. And thank you all. And I'm sorry.
So the whole purpose of the regulation, ma'am, is to find the disease and to make sure that we're taking steps when the disease is discovered. It is not, it is to look for cooperation, and we're not looking to push people out of doing extracurricular activity. That's not the idea. So we've worked with the schools, and we're trying to make sure that everybody's working together to make sure that the season or the extracurricular activity continues without interruption. It's simple as that.
So
I think you're reading way more into it.
I agree with helping people, but I also agree that when you have a medical test to be done, it should be up to the parents, not up to a board.
So I will definitely bring that to the school's attention. I appreciate that. We weren't aware that that was occurring.
And I also believe that if you're going to get a test, that it
You're going to have to step up to the microphone because we can't hear you.
I believe if you are going to get a test, it should either be, if it's a medical test, it should be done as a doctor would do it. If you have strep throat, you don't go to the nurse's office to get a strep throat test. You go to the doctor's office to get a strep throat test. I believe any medical test in that, if I go get an x-ray, that lady can't tell me anything. The doctor has to tell me the information.
No, but the doctor doesn't do those tests. Often the doctor doesn't do the throat swabs. The doctor certainly doesn't take your x-ray. He interprets them, or she interprets them.
But if
he-
my child goes to the doctor's office, they give him a COVID test. That when the COVID test, the results come back, it gets talked to you by your doctor. Not by a nurse, not by anybody else. Your doctor, it's his
Not
job.
always, no.
Oh, what doctor do you go to?
It doesn't matter, but you can go to any urgent care center and get a COVID test, and you get report, and it gets reported to the state. And in turn, the local public health people will often call people and tell them that they have a positive test.
So if you
The
force,
doctor doesn't always, sometimes the last one to know, I hate to tell you, but,
Don't you go to a CVS and get the test done?
and then they tell you, they're technicians.
Yeah.
okay. But if you go to a CVS, that's not mandatory. That's on your own will.
And it's not
it's the same
it's not
thing, though.
mandatory to
So if the kids
participate
stay
in
after-
extracurricular
If
activities
my
either.
children stay after school for an after-school activity, do they have to be tested?
They have to be tested for any extracurricular activities.
So do they have to be tested?
Yes.
They do.
But they don't have to do
Law says that you should
extracurricular.
not require testing.
Okay,
It's
thank
in the
you.
Mass Department of Education laws and regulations. I think you guys should all read it. You're violating pretty much the entire thing. The entire thing.
Have you read it?
What is it?
Mass Department of Elementary and Secondary Education laws and regulations. These are the laws.
As the Board of Health, we can also have our own regulations.
Right. This is a school.
When
You're
was that?
violating the right. It says you have no authority
An
over.
extra copy of that?
You are not obviated or alleviated by any local law or rule or regulation of any organization, club, athletic, or league,
So
or association that would limit the eligibility of participation.
So
of
we're
any-
straying from the agenda here.
Yeah.
This,
So I'd
this,
like to have a meeting about this,
so
and I'd also.
if you would request, if you would request a hearing in writing, ma'am, and the specific topic and order that you wish to discuss, please put that in writing, and we will put it on the agenda. We're really not allowed to discuss items that aren't on the agenda presently, but we tried to give you the respect.
So do you have to be invited to this meeting, or can you?
No, it's an open meeting, but we can't really have a discussion on something that's not on the agenda.
Absolutely.
It's an open meeting law violation.
Absolutely. Thank you. Have a good day.
Thanks for coming.
Hopefully we get somewhere with it. Thank you for all of your time.
Okay. Shall we go to the agenda now? or-
Yeah, that's a great idea.
Well, first on the agenda is the approval of the meeting minutes of the November 4th, 2021 meeting.
Everybody read them?
Did-
I did.
Yeah.
So I make a motion that we approve those minutes from Where is it? November 4th, 2021, as is.
And I'll second the motion.
Let me see. I had one question about that.
Oh, you had something?
So there was Dr. Strang was his name, I guess?
Okay.
He's listed as a law professor. I thought he said he was a philosophy professor.
He did say philosophy.
So that's on page 4 of the minutes.
Where in here does it say law?
It does say law professor, I do
It does?
recall
didn't
reading
see
that as well.
one.
It's on page 4,
Page 4, thank you.
the third full paragraph.
I can't do anything with these gloves.
Page 3.
Yep.
Oh, is it? Okay. My packet says, okay, so it's page 3 of the, yeah,
Strange.
page 4 of the packet, page 3 of the,
Oh,
of the minutes.
whereabouts, John? Oh, law professor.
Yep.
Should we change that then?
Yeah, we should make a motion to accept the change and then accept the amended minutes,
I'll make a
or
motion.
table it.
I'll make a motion to accept that change.
And I'll second that motion.
All in favor?
That's a good catch.
Steve, do you want to go on then to the COVID-19 update?
Sure. So I put together a little slide presentation just so folks at home could see the numbers. As of today, December 2nd, I have listed the numbers and I have compared them to 1 month ago, which was November 2nd. Cases since the beginning of time when we started tracking COVID, since March 1st, 2020, we are now at 6,646 cases. That's 659 more than November 2nd, 1 month ago. Active cases, we are at 349. That's 209 more cases in the last month. In the last 24 hours, we've seen 43 confirmed cases. That's 41 more than 1 month ago. A lot of that may be a result of our new test site that is on Nursery Lane, that's operating on Tuesdays and Thursdays, and on Mondays and Wednesdays, it's at Doyle Field in Leominster. So I think that may continue to rise as we see activity at those test sites.
And can I just interrupt, Steve? Are these kind of walk-in folks who, anybody can go to the
Yes.
testing sites?
Yep.
Yeah.
And that will be part of this presentation. So in the last 7 days, we've seen 163 cases. It's about 92 more than 1 month ago. 14 days, 379, 225 more than a month ago. We've had 7 deaths in the last month. Our positivity rate has gone up from 4.5 to 8.3.
Oh.
So I tried to get some vaccination information. This can also be found in your packet. To try to get some numbers out there just to get a rough idea. Right now, it looks like Fitchburg as a whole, about 56% of folks are vaccinated. This graph shows the population and according to age. Sorry, this is on page 26 of the packet. If you tough time seeing that. But basically, it breaks down the age groups. And I'm hoping the folks at home can have a look at it. But so fully vaccinated, numbers look like, make sure I can see it myself. We're looking at about 57% of 12 to 15-year-olds. 47% at 16 to 19-year-olds, 44% of 20 to 29-year-olds, 30 to 49 is about 66%. And then from 50 up to 75, we travel all the way up into the 88 to close to 90% range, which is sort of a good thing that our elderly are getting vaccinated. The next slide, which is also in the next page of your packet, sorry, I'm jumping around. It shows vaccination by race. So about 64% of our Asian population is vaccinated in the city. The black population is about 58%. Our Hispanic population is 41%. The multi-race, we're looking at about 52% in the city. And then our white folk are around 60%. And the chart also shows partially vaccinated.
Steve,
Should I
how
keep-
did these numbers come about? Just from the screening forms and everything that we,
So these are accumulated by the Department of Public Health.
oh, okay. I didn't know if this was,
There's a ton of information there, and it's really not easy to grasp it in just a few seconds, but it,
yeah, I find it interesting that the
Yeah.
Asian population supersedes all of the others.
and I was very impressed that our Hispanic population is a little better than I thought it was.
41%, yeah.
Still makes me wonder why the young people aren't getting vaccinated. As you said, the people 65 and up are in the high 70s to 80%, but it's young people who don't seem to want to
Get vaccinated.
vaccinated, yeah.
Is it the young people or the young people's parents?
Well, they're teenagers, or they should be responsible for themselves, but it, yeah, it may be.
Maybe.
So I'll keep moving. I just wanted to mention again that our nasopharyngeal swab PCR test site operates on Tuesdays and Thursdays. When we opened today, it was very busy. It looked like at least 100 people in line this morning or this afternoon, and it was very busy throughout the afternoon. So I'm glad people are taking advantage of it. People can also take advantage of the Leominster site, which is on Mondays and Wednesdays at the same time at Doyle Field. And this whole partnership, collaboration of testing is supported by Mock. It is actually at the Mock facility on Nursery Lane, 49 Nursery Lane. It is also provided by the Department of Public Health and with assistance from Health Alliance Clinton.
And just to clarify, fully vaccinated, does that mean for, let's say, Moderna 2 doses, or is that including a booster shot? Do you know?
I'm sorry, you're talking about the,
When, under the title of fully vaccinated individuals?
oh, you're back on the chart.
Yeah, I'm sorry.
Yes, so fully vaccinated would be considered somebody that has received 2 Moderna or Pfizer vaccine, as well as 1 J&J. The booster information is that I know of not available as of yet.
Gotcha.
And then I just would like people to know that it is on the city webpage. It is also on our Facebook page, the Fitchburg Board of Health Facebook page. There will be vaccination clinics right in this building at 700 Main Street, which is the legislative building. This Friday, or actually tomorrow, which is December 3rd, also December 10th, and on Friday, December 17th. I encourage folks to find a link and try and make an appointment. Walk-ins are welcome, but it might be a little time-consuming. And we have already over 300 people signed up for tomorrow's clinic. So They're busy. Walk-ins are welcome, but if you can sign up or get somebody to help you sign up or whatever you need, get signed up and get vaccinated. And that is the entirety of my presentation.
Thank you very much. That's a lot of helpful and very good and detailed information. Appreciate it. I think we could probably move on to the hearings then,
I think we should do that, yes.
all right?
Well, are they hearings? Are they hearings? Is it correct to call them a hearing? No.
I'm sorry,
It's not a hearing, is it? Or is it a hearing?
Well, actually, it's a petition.
yeah.
And there is a
Petition.
difference.
So Jacqueline Wetchy, familiar face to us these days. Here, I'll let you speak for yourself, but petitioning to rescind the entire BOH mask mandates.
Yes, before I did have a question on the presentation. I saw on the news the other day a doctor saying that test positivity rates are becoming a less and less valuable means of evaluating where we are because of the proliferation of home testing. People take a home test, it's negative, okay, I'm fine, they throw it in the trash. But if they test positive, then they contact their doctor and say, you know, what should I do? How should I quarantine? And then it gets recorded in the system. So do you think these test positivity rates are inflated due to that factor?
No, I think they're underinflated,
I agree.
definitely. And not all of the home test kits get reported to the state data system. There's one, I think the Binax is the only home test kit that has the app that you can download. You have to scan the QR code or something. And then I'm not sure how lucky people are at, I couldn't get mine to go on. I guess I'll have to test again to try. But they don't all get reported, Jackie.
Okay. So my first petition is to remove the municipal mask mandate. The premise behind it is that masks are going to keep us safe. But despite mask mandates, the virus has spread throughout the world, the country, the state, and the city. If you turn the page, you will see, according to the CDC community transmission map, that states that have not had mask mandates are in better shape than we are. States such as Florida, Texas, South Carolina, Alabama, and Georgia. I looked at this again today. Some of those have moved from yellow into orange, but Florida's doing exceptionally well. They're probably going to flip into blue soon. Whereas we're in the red zone, we had a state mask mandate for over a year, and various municipalities have local mask mandates. The solution to COVID is not masks, it's vaccinations. In the October meeting, I presented data from the Mass DPH COVID dashboard, last month from the Massachusetts Vaccine Equity Initiative dashboard. And for this meeting, I found a third dashboard that is relevant, and that's for Fitchburg State University. If you turn to the next page, you will see that 90% of students at the university are vaccinated and 95% of the faculty and staff. The most recent data they have is as of October 22nd, and I'm thinking that's because it probably isn't going to change much in the course of the semester, that they wouldn't need to update it weekly. We know that this information is complete because students who did not provide their vaccination status have all been expelled from the university. We turn to the next page. The COVID positivity rate there is 1.43%. This is not a fluke. We go to the next page. We see it has been consistently below 3% for the entire school year. On the following page, the final week of the school year is at the top, and then the average for the school year is in the middle, 1.3%. And then on the next page, out of more than 4,600 students, none are in quarantine, just one is in isolation, and there are minimal positive tests, 2 for students and 1 for staff. They are doing really excellent. They've easily exceeded the 80% benchmark that you have stated at previous meetings is what you're looking at to remove a mask mandate. You're never going to get to 100% vaccination there because there are religious and medical exemptions, but they're doing really well. Just as you're never going to get to 100% vaccination, you're never going to completely eliminate COVID-19. It's not like smallpox. It's a coronavirus, the same as the common cold, and it will continue to spread and evolve. We see this internationally with the Omicron variant, and domestically we see that COVID-19 has found a new host. It has moved into the deer population. Rachel Rudin, Iowa State wildlife veterinarian, and others did a study reported in the Des Moines Register on November 2nd, showing that 85% of the deer in Iowa test positive for COVID-19. Other states have also done similar tests and found COVID-19 in deer. This is a new host, and even if we wiped out COVID from humans, it could come back to us from the deer population. It would be nice to think that we could control nature, but we can't. If we could maybe not just only get rid of COVID-19, but get rid of rats and mosquitoes and cockroaches and other things we don't like. But COVID can exist in animals as well as humans. It probably came to us from bats originally. It's an endemic virus that is here to stay. So we need a little bit of humility in dealing with it, instead of thinking that by piling on mandate after mandate and restriction after restriction, we can stop the virus to learn to live with it. Humans have a right to control their bodies, including their faces, rather than be forced to wear masks forever because of an endemic virus. Keeping the mandate in place devalues liberty and posits that only safety and not liberty has any value. But in fact, liberty has inestimable value and is the very foundation on which this country was built. Benjamin Franklin said, "Those who would give up essential liberty to purchase a little temporary safety deserve neither liberty nor safety." At the last month's meeting, Mr. Strang spoke about a slippery slope where we lose our liberties in the name of safety. A good example of this is the country of Singapore. Like us, they're a democracy. Like us, they elect their leaders, but they've taken a very different approach than we have historically. Now, if someone chews some gum and they take it out of their mouth and it's got all their germs on it, that's kind of disgusting if they don't, dispose of it properly. That could be a health hazard. In Singapore, there's a $1,000 fine for a first-time offense, possession of chewing gum. If you throw a cigarette butt on the ground there, it's a $300 fine, first-time offense. Same fine as you impose, $300 for not wearing a mask in a municipal building. If you don't flush the toilet there, you're fined. They run random drug tests on both locals and visiting foreigners, and they really go after jaywalkers. I don't think that's what we want to do with our country. I'm asking that you restore our liberties and repeal the mask mandate and let people take responsibility for their health by getting vaccinated. And I know you shot down my petition in the past, so if you don't approve a rescission of the mandate in its entirety, I would ask that you at least remove it for Fitchburg State University. They've done everything right. You're not going to get better results than you've got there. The city solicitor has told me that there must be a rational, factual basis for your orders. They can't be arbitrary. You previously stated that an 80% vaccination rate is good enough to lift the mask mandate. They're well above that. All their statistics are excellent. You should be praising them. You should be thanking them. And you should be restoring their civil liberties.
I think that all of the information that you just told us about Fitchburg State is wonderful. And I mean, if it's all factual, and I'm not saying that you're making it up or anything, but I think maybe it's something that we should explore if that's the case. It scares me to say that, but especially in lieu of how things have gone over the past 3 weeks or so with all the cases. But Fitchburg State has done a great job, and I don't know how the administration feels there, but maybe we should explore that a little bit. I think you're got a good point there.
To answer your question, the data comes from their own website.
I would agree, and I'll just put as an aside, I've been to Singapore, and you're quite right about the rules they have. In fact, the minute you step into the country, you're handed a card with the penalties that exist for littering. Drug possession, for instance, can come with a death sentence. And most recently, I think they passed a law that if you're not vaccinated and you get COVID, you'll be responsible for all your own medical costs. In other words, they're not going to tolerate people who decide, unless you have some of the usual reasons for not doing it. But if you don't get vaccinated, if you don't comply with the regulations with regard to COVID, and then you get it, you'll be responsible for your own medical bills. It's an interesting place, but it works. It's one of the cleanest and safest places I've ever visited.
I wonder who enforces all of that? Not the public health people, I bet.
No, I'm sure they have police. But
I'm
even
sure.
when you ride in a taxi there, they remind you of it consistently. Don't throw anything out the window. Don't drop anything. But anyway, with regard to Fitchburg State, I think we have said that if someone reaches an 80% vaccination rate, that we would lift the mask mandate. I think we've said that in the past. I'm not sure why Fitchburg State hasn't come to us and asked to do that. It may be that they feel that they're still doing what's safe and what got them there. I think the question always is how much of what got them to this 80% vaccination rate and low COVID incidence would be that people are doing all the things they need to do. They're getting vaccinated. If you're not going to be at the university. They're still wearing masks, so how much does that have to do with it? It would be a little bit, I think, of an experiment to let them go without masks, but we have said it, and I think even at the state level it's been said that once an 80% vaccination rate has been attained, that the mask mandate can be lifted. So I would agree. I think it's certainly something to be explored, and if in fact that's the case, then I would favor going with what we've said in the past.
Would you be willing to repeal the mask mandate, but effective a week from now? So if they, for whatever unknown reason, decide they want to put a mask in at the university level rather than the city level, they can do that. But you don't have to come back and meet again. You've removed it from your city mandate. It wasn't even part of the original city mandate. It was added, so I think it could also be subtracted.
Right, and I think from the beginning we've said if someone reaches, or if some institution reaches an 80% vaccination rate, that they would not have the mask mandate. So I think it's already been said. But I don't know, Steve, how we would go about doing that. But I would favor, as long as the university's okay with it. And as you said, they would have the opportunity, if they didn't want to lift the mask mandate, they wouldn't do it. Just interestingly, I think the library itself has said, no matter what happens, they want to continue the mask mandate. I think they just feel safe. They feel the people who visit are safer, the staff are safer. So I think even though people do reach certain low positivity rates, that they still feel safer wearing masks. So, yeah, to summarize, I think certainly I would favor, and it sounds like maybe you would, Sandy, and I don't know, Ian can certainly put in.
Ian, you work
what he-
there. How do you feel? What's the gist that you get from your place of employment?
I'm happy to wear the mask. I work with nurses all day in fairly close proximity. That's people who are on hospital floors quite often. So we all wear a mask pretty much I wear one all day. All our students who come in wear a mask the whole time they're in there, which is 3 or 4 hours at a time.
Yeah, if we lifted the mask mandate for Fitchburg State, certainly anyone who wanted to continue to wear a mask could do that. It just wouldn't be something that individuals would be mandated to do.
So, I would ask that you repeal that portion of the mandate, that I believe you need to vote on it. And if you set, an effective date in the future, then they can do something on their own if they feel it's necessary, rather than having it fall under the city mandate.
I would make a motion then that we, before we spring something on the staff, the administration, and the university, that we make some inquiries and let them know what we're thinking. So let me see, how can I phrase this motion? I make a motion that we repeal the mask mandate once we have established communication with the university, and then make it effective January 1st.
I would agree with that, and I would second that motion.
I mean, that kind of leaves it up to Steve to, or somebody to call them and just to tell them what we're thinking, and, I mean,
No problem.
certainly people will still probably wear masks, and I hope that their positivity rate doesn't go up, that's for sure, but they've done a great job, and I think that we should repeal it.
Well, I think they're coming up on a break as well, so they're probably not even thinking about that at the moment, but maybe that's something we bring to the table to discuss and see where their thoughts are, for sure.
And Jacqueline, I just have to tell you that up until about 2 weeks ago, I was seriously having thoughts about maybe we should think about repealing the mask mandate for the municipal buildings in Fitchburg. But then, now look at how things are out there. There's just no way I would want to do that now. You know, the rates of the COVID positive cases were up over 3,000. Yes, people are dying. That kills me to hear the hospitalization rates and the number of people that are dying. So I still have to be in favor of the mask mandate. There are 112 municipalities in the Commonwealth that have mask mandates.
You mentioned hospitalizations, and I read something interesting. It was a report from Mass Alive, back on actually the 19th, and it said, there are currently 642 patients being treated for COVID-19 in Massachusetts hospitals. It's obviously changed since then and now, a figure that's risen steadily over several weeks. The total includes those being treated for reasons other than COVID-19, but who've tested positive. In other words, I can be fully vaccinated, I have no COVID symptoms, I go to but I have a breakthrough infection that I don't know about. Then I go to the hospital with a heart attack. They do a COVID test. Oh, you're positive for COVID.
Not in the hospital for COVID. You're in there for something else.
Right, but I'm
and
still
tested
counted as a COVID hospitalization. So that's one problem with the statistics.
I don't know how they're calculating that. If that's what they're doing, then that's what they're doing. I wouldn't think it would be, I know people are still getting, I've talked to people today that could hardly breathe on the phone because they were all congested and had upper airway congestion. So people are still getting sick from it and need to be in the hospital. I'll never be convinced otherwise. Maybe some of them are, just happen to get it along the way, unfortunately.
I think there was actually some very good news. If you think back to the first vaccination ever in 1796, that Edward Jenner developed the vaccine against smallpox. The whole reason he came across this vaccine was he noticed that milkmaids got cowpox, and it was much milder, and it gave them protection against smallpox, which was much more virulent because cowpox and smallpox are related. And we see now the Omicron variant is a very mild variant from everything we have learned so far, and it's very transmissible. So if we have this mild Omicron that races around the globe and people just get, some mild flu-like symptoms for a couple days, and it gives them protection against the Delta and the other more dangerous variants of COVID, I think that could be a great thing. That could be the end of this.
Well, I hope you're right. I would fall down at your feet if it was, if that was true.
I'd just like to say a few things. So I haven't really spoken too much these last few meetings. I've kind of left it up to Dr. Bogdasarian because he's the expert, and Sandy is another expert here. And you spoke about humility earlier. I am not a PhD, I am not an MD, I am not a virologist, I'm not an immunologist, I'm not an epidemiologist, I am none of those things, and I don't think you are either, unless you've left that out. Just a quick look today, the journal Nature, which is one of the premier science journals in our country, October 6, 2020, the science supports that face coverings are saving lives during the corona pandemic. The Journal of the American Medical Association, community mask wearing is an effective non-pharmacological intervention to reduce the spread of this infection. A Stanford and Yale study is a large randomized trial, which is the gold standard in evaluating public health interventions. Wearing a mask over the mouth and nose is an effective way to reduce the occurrence of COVID-19 in community settings. January 2021, the Proceedings of the National Academy of Science of the United States of America. The preponderance of the evidence indicates that mask wearing reduces transmissibility per contact. Science Magazine, one of our premier journals, June 2021, face masks effectively limit the probability of SARS-CoV-2 transmission. Mask wearing is supported and encouraged by the WHO, the CDC, Johns Hopkins, MGH, Boston Children's Hospital, St. Jude's, and the list really goes on and on. I mean, these are experts. These are people who know what they're talking about. They have the same information that you have, and you're interpreting it in such a way that it makes sense to you. And it does. It can make sense to someone who maybe doesn't have 30 years of experience in the field. I respect you. I'm glad you're here and not on Facebook taking shots at us like some people do. I have opinions too. But on this, I'm not going to base the safety of the city I'm supposed to be representing through opinions that are really not as educated as some other people's. It's not that I don't respect you or not saying people are smarter than you. I'm just saying people have more experience. They've looked at more information. They have access to more information. I know experts make mistakes too. I know they've made mistakes about this virus. But it's new, they're learning, and as new evidence emerges, they tend to change. They don't just cherry pick studies here and there that support what they think. The CDC map that you're showing, if you break it down into the county view, you'll see that cities pretty much everywhere are pretty high spread, and that's because there's a lot of people there. I mean, there are different ways to interpret these maps. And I'm not saying your way is wrong, but it's just one of many, and experts interpret it differently. According to the National Law Review, across the board, constitutional claims against mask mandates of general applicability have failed. They easily clear the bar of rational basis review. You mentioned Florida. If you do some research on Florida and ask yourself, why is Florida doing better despite not having, mandates, despite being against vaccine, not so much against vaccines, but despite not taking this maybe as seriously as we seriously, in quotes, as some other states. There are many articles out there that actually an indication that Florida has done worse because it spread so quickly through there, through the months, that pretty much anyone who was going to get infected already was infected. Because they were doing very bad when other people were, staying pretty even-keeled. And so I respect you. I respect the other woman here that spoke, but I just can't, in good conscience, make these decisions based on these opinions and these interpretations of opinions.
Well, you said there are different ways to interpret the data, and you talk about cities. The most comparable community to us is Leominster. It's our twin city. It's got a similar size population, and they've made different decisions. I think the real issue is maybe not so much data, but do you believe that liberty has value, or do you want to say, even if a mask is only 20% effective, as Dr. Bogdasarian said, or maybe suppose it's less, suppose it's 10% effective, suppose it's 1% effective, should we all be wearing a mask the rest of our life? You know, at some point,
Never said anything about wearing it the rest of our lives. I think I think people are kind of in denial about bad news. These things, this is a new virus. It's going to continue to be studied. They're going to continue to come out with medications that better deal with it. That's how we deal with these things. That's how this works with pretty much everything. Cancer treatments get better. HIV treatments got better. Treatments for this will get better, and we won't need the mask. But for now, pretty much every scientist out there, everyone who's an expert in this field, is saying that social distancing, mask mandate, wearing a mask, social distancing, and you're taking a multi-tiered approach, which Fitchburg State has done, which, I mean, you've interpreted that as being all vaccine, but they've really done all of it. They've done hand washing, they've done vaccines, they've done masks, they've done distancing, and they still do it, and they're doing it really well, because I'm there and I see it. And I think all those things have kept us safe and have kept these numbers low. And that's just how I would interpret it. But again, that's my opinion. I'm going to listen to the experts on this.
there's certainly other ways to interpret it. We see in Europe that Austria, Germany, France, and other countries have said, if you're vaccinated, great, go about your life. If you're unvaccinated, then we're going to put restrictions on you. And a couple weeks before that went into effect in Austria, people at advance notice there were long lines of people lining up to get vaccinated because they didn't want to be restricted. You've got a system where you treat the vaccinated and the unvaccinated identically, and it's a disincentive to vaccination. Why get vaccinated, especially if you're young and you're not at risk of a serious outcome from COVID? You've seen in the statistics Mr. Curry presented that you're having trouble getting the young people vaccinated because you're treating them the same as the vaccinated and the unvaccinated the same. You're creating moral hazard. Why do something good if the person who doesn't do it is treated the same as me?
Well,
I think that's to me, that's an odd perspective. I got vaccinated to protect myself, not to win anything, not to be given my freedom back. I mean, it wasn't that little Moderna pass saying it wasn't a prize to be won or reward for being a good citizen. It was to keep me safe from a virus. This is very objective. What you're bringing is subjective kind of opinions on this. But objectively, these are the things that keep us safe. And like I said, all these things you're saying about Austria and whatnot, these experts have access to that data, and yet they're still telling us this. And I'm going to go with them. And I welcome you back, and every opinion is important. And the experts might change their opinion in a week or 2 weeks, and at that point, I'll listen to them when they do that, because they back it up with evidence.
Well, you have a public health perspective. I don't know that, most people have that perspective. For instance, I have several coworkers who are anti-vaxxers, and one of them has said to me, the only thing that might get me to get vaccinated is I want to go to a Bruins game this year. So
I think that is, I don't understand that mind. It's not a prize. This isn't going to a child's birthday party and pinning the tail on a donkey and they give you a prize at the, I just don't get, I understand that that's how some people think. I don't think it's a necessarily productive way of thinking.
That's what Lunenburg is doing. Lunenburg is saying if you want to go in a city building and you're not fully vaccinated, then you wear the mask. So there's an incentive to get vaccinated if you don't want to wear the mask. You've got to kind of meet people where they are rather than having these high ideals, which not everyone is going to want to follow.
Which is why we've kind of limited the mask mandate to municipal buildings. There are still some cities out there who are doing it citywide and putting it on private industries. We've decided not to do that. We're trying to protect people in municipal buildings. You've told us that the library didn't want it, or you thought it was burdensome to them. They came back and told us it wasn't a burden, and they feel safe with the mask mandate.
Well, if you did lift your municipal mask mandate and the library put in a mandate, I'd be going to the library board of trustees meetings and I wouldn't be coming here.
You come here in your mask. Is it warmer over there?
It
I
seems,
wear it because I have to not get fined $300, and I come because my freedom is important to me, and it's a matter of principle.
Then that's good.
But I tell you, I've been to, since the last meeting, I've been to 4 different libraries that didn't require me to wear masks. And I was
And that is
welcome,
their
and I
decision
felt
to
happy.
make as a town.
What?
That is, as a city or town, that is their decision to make, their Board of Health.
I don't know why I have to be so unlucky as to live in the strictest place around.
I think a lot of people feel differently about that.
so you've been vaccinated, right? And
Yeah.
did you get your booster? I know
No,
you.
I told you at the first meeting, I'm not going to get my booster because I feel like I got vaccinated for nothing, and you're still restricting me.
See, I have trouble understanding that because you're not getting vaccinated or boosted for nothing. You're getting boosted to protect yourself.
I'm not scared of COVID. I'm not concerned about it.
It doesn't really care if you're scared. I mean, that's injecting a personal, you're personalizing the virus. It's not a person. It doesn't care what we think about it. It doesn't care if we're afraid. It doesn't care if we think we're tough. It just doesn't.
And I don't want you to get the virus, but if you do, and you end up in the hospital on a ventilator, then you might be scared. And by then, it's going to be a little bit late. So the reason that we do these things is to prevent that from happening. And, it seems to me, let's assume you've at least gotten 2 of the vaccine doses. What you're concerned about is the need to wear a mask in certain places, under certain locations. And I'm also understanding you regard that as an imposition on your freedom.
Absolutely.
Yeah. But I think you also have a responsibility not only to your own freedom, but to other people. And when you go around, you might have the virus. You might be spreading it around by your breathing on people. So I think there comes a point where an individual's freedom gets superseded by the freedom and the benefit of the whole society. And I think that's where I'm having trouble understanding the arguments that we're hearing here, that an individual's freedom should supersede the benefit of society. And I think Ian has well pointed out that there are numerous studies that show that mask wearing is protective. Is it such a burden to wear a mask for months or even a few years
Yes.
until we get this under control?
Yes, it is a burden to me.
Okay.
And when you think about it, if the mask prevents the particles going out, it's also going to prevent the particles coming in. So if people are worried, they can wear a mask. I've even suggested if there's some nervous Nellies in the city, you could buy them hazmat
Again, you
suits.
see, that's nervous, not like you're personalized. I mean, that you're putting emotion into it. You're getting emotional about it. It's not, I understand it is an emotional issue. There is a whole mental health side to this that I feel bad for people. I feel bad for myself. My mental health has not been great being distanced from my family and friends.
I'm glad
But a nervous Nelly, it's someone who wants to protect themselves. It's a virus that's killed a lot of people. That's made a lot of people sick. It seems to be a normal human reaction to want to live. I mean, our instinct is to survive.
Let me ask you this. Do you travel at all? Do you want to go on an airplane?
No,
You don't? Okay.
No.
See, I think, and so if it meant that you had to wear a mask to go on an airplane, you wouldn't do it?
that's correct.
Jacqueline, I bet that if we did an oxygen saturation level on you with the mask on and without the mask on, it would be the same. You know, one of those little clip-on things that you go into your doctor's office with. I bet you the oxygen is getting through that mask and not affecting your ability to breathe.
Well, it definitely bothers me, and there is also, as Mr. Murray has mentioned, a psychological component that when you force people to live in a constant state of fear of the virus, that kicks off the stress response, and that's not good for us. We've seen that during the pandemic, because people haven't been allowed to lead their normal lives, that we've had increases in depression and mental health issues. We've had increases in suicides. We've had increases in domestic violence. We've had increases in drug abuse. And the mask is the most visible symbol of not being able to live our lives normally. So you say there's no downside to masks. There is.
No doubt, but I go in, very rarely do I go into a store, grocery store, or a department store, but I did today, and almost everyone had a mask on, and it was not required.
That's what I would call, I'll do me, you do you.
Oh, really? You think so?
Yeah, should be a matter of personal choice.
Where do you, would it be rude of me to ask you how many times you go into a municipal building where you have to wear a mask? I'll bet most of the time you're probably home or doing whatever you do during the day. You don't have to wear a mask for that.
Well, I've been going to other libraries rather than go here, so I don't have to wear the mask. If I go to a store and they say mask required, I don't go in, I go somewhere else.
Okay.
Well,
That's you doing you.
yeah, I think these are things that are probably somewhat difficult for us to understand because we think it's the safe thing to do, but each to his own, and everyone can do what he wants, but you're kind of closing your own life in some ways by not going to municipal buildings, not going to stores that require masks, not going to restaurants that require masks, not going on airplanes, and not going to Bruins games, it seems. So there's lots of things you're going to shut yourself out of. And I think all of those organizations have put in mask mandates for a reason, and that is that to wear a mask increases the safety of the people who are there. It's a nuisance. None of us likes it. We're all looking forward to the time when we won't have to do it. But until that time comes, there are worse things that, that we'd have to do in life to be able to do what we want. Anyway, excuse me.
I think there was a motion on the floor.
Yes, there was. I made
And
a
then-
motion about Fitchburg State, and did you second
I
that
think Dr.
motion?
Bogdasarian seconded,
Yeah,
but I
but
don't know.
we didn't get it, we did not approve it,
I'm in
so
favor.
we're all in favor, I think, so motion carries.
Okay, so that passes. Should we move on to the second item?
To the
then?
second item, yes.
Yeah, my second petition is I want to bring some accountability to the waste hauler service in the city. I came up with something called 3 strikes and you're out, that all future contracts for waste removal in the city shall contain a provision that if during a fiscal year the hauler fails to pick up any category of waste 3 times, the property owner shall have some recourse, with there being 3 categories of waste: trash, yard waste, and recycling. After 3 times in which a category of waste is not picked up on the day scheduled, the property owner shall have the option to hire another hauler to pick up that category of waste for either the duration of the fiscal year or the minimum contractual period of the other hauler. The property owner shall then deduct the full cost of the alternative pickup from their next unpaid property tax bill or bills, and the city of Fitchburg shall in turn deduct those costs from the next payment to the contracted hauler for the city. Now, we do live in a 4-season climate, so there may be times they can't legitimately come out due to inclement weather or natural disaster or other circumstance. If so, they shall have 1 week to collect the missed waste. After 1 week, if the waste is not picked up, it shall count as a strike against the hauler, unless there's a second excuse event within that 1 week time period. For example, you have a snowstorm on December 1. The waste should be picked up by December 8, but there's another storm on December 5. That would push the deadline to December 12th, which is 1 week from December 5th, just as an example. And I certainly wouldn't want the hauler to be able to say, oh, there's a few drops of rain, I don't have to come. So I also wrote that the 1 week excuse shall only come into play on days where the weather, disaster, et cetera, causes the cancellation of the public schools. I think that's an objective measure. And if school is not scheduled to be in session, then the delay shall only come into play if the governor has declared a state of emergency, or the National Weather Service has issued a winter weather advisory or warning, severe thunderstorm watch or warning, tornado watch or warning, hurricane watch or warning, excessive heat watch or heat warning, or flood watch or warning for the city of Fitchburg. As it stands now, they don't do their job, there's not really any consequences.
Again, have you read this from city regulations, just to know where you got this 3 strikes and you're out?
No, that's something I'm proposing be added to future contracts. It's not an existing regulation.
I see. And
So I would put out to the board in their packet on page 20 is actually a copy of the contract.
I don't have a packet.
This would actually be, the 3 strikes would actually be less stringent than what is exactly in place already. We already do have the ability to, if a waste is not missed,
page 20.
if a waste is missed and it is not collected by the end of the following day, I do already have the ability to implement a $25 fine per missed waste. I also do already have the ability to call another hauler. The hauler can come out, and whatever cost incurred, I can reduce from the monthly bill. Already in place. Don't need strike 2 and strike 3.
So how often are you utilizing these provisions?
Once in a while, but it's not on a regular basis. It's not something that other haulers are interested in doing. It's usually when it's needed is when there is an extended delay, such as many storms, as you're referring to. There was a 4 or 5 day delay. I did explore several waste haulers. None of them, as I state in plenty of meetings, none of them are waiting around looking for work. There's no garbage truck sitting idle waiting for work. These things need, rubbish trucks are $1 million. The planning needs to be done. So when contracts are coming up, these haulers try to plan and bid on these contracts. And then they purchase the vehicles to what the contract details, and that's how they decide how they're going to do the job. I can't call. I've called Republic. I've called number 2, number 3, number 4. They're not going to step on each other's toes. Number 1, and number 2, they can't pick up a large, an entire day's route on a drop of a call. They can't do it. So they would have to make arrangements, and it would take several months to do that. And instead, we can issue fines if that's necessary. But other than that storm, that yard waste collection storm you referred to, where your waste wasn't picked up for several days, there really isn't that. The circumstance doesn't exist.
Well, it's certainly been better in the fall, but in the spring, they only pick the yard waste up on time, maybe 10% of the
They're
time.
on a 1 day delay now. Again, yard waste, as we said before, is very difficult to plan for. We have no idea what's going to be out there every week. Rubbish and recycling are very easy. You have 64 gallons of trash and you have 96 gallons of recycling. Yard waste, you may rake this week. Next week, you may not rake. Thanksgiving is very common. People have it off. It's very common that people are out working in the yards if there's no snow. Right now, there's a very, very heavy load of yard waste, which has pushed it behind. I'm not making excuses. It doesn't make me happy to answer all these angry calls either. But as long as they get it within 24 hours, that's the contract. And to call another hauler to come out pick up yard waste, if it goes beyond 24 hours, it's just not possible. And they will tell you that.
Have you tried 1-800-JUNK and Junk King?
1-800-JUNK King will not pick up yard waste on a Wednesday route or a Monday route.
You're talking about 1-800-GOT-JUNK, that?
Yes.
1-800-JUNK or Junk
I've called them
King
and
is
they-
another one.
I've
They're
called
not,
them for other
they're not
things,
equipped to do that type of collection.
and they don't come inexpensively either.
No, they don't, but
There are
if you-
rules on top of it, what vehicle you can use. Junk King does not have the type of vehicle that is preferred by the contract.
Again, just for some background, well, I've lived in Fitchburg for 43 years now, and I can't think of a time during which we've had a problem with collection. It hasn't been picked up or it's been strewn around. In 43 years, I can't think of a time when we've had a problem. Sounds like you've had, is it more than once you've had troubles, or is this?
Oh, it's been going on for years.
And specifically what, that they're...
It's the yard waste, so I guess I'd ask you, Dr. Bogdasarian, do you frequently put yard waste out?
No, fortunately, I live in a place near woods, so we blow all the leaves into the woods, and that's it. But, and so I was going to ask, when you have yard waste, don't you have to put it in certain bags and bundle it up?
Bags or barrels?
Yeah. So if it sits there for an extra day, is that offensive to you, or what, why is it?
Well,
that's-
it blows, the barrels fall over, they blow in the street, it makes it slippery to drive on, water comes into the barrels, and then they start to smell, and you get insects like mosquitoes growing in there. It's just not a good situation when they don't pick it up like they should.
And typically, how long a delay is there for this to be, for these to be picked up?
The longest it's been was one time it was over a month, but usually it's like, what will often happen is like Mr. Curry will say, oh, well, we swapped weeks and it's going to be next week, or they'll pick it up next week, and then the next week comes and I email them again, they still didn't pick it up, and then he says, well, they told me tomorrow, I don't know what the story is now, and then tomorrow comes and they still don't pick it up, and then I contact him again, and I'd like to stop contacting him, and I'm sure he'd like to stop hearing from me.
That's not true. Are you signed up for Recollect yet?
No, because I don't have a smartphone.
Do you know how many times I get yelled at today because of missed yard waste last week? Probably 15, 20 times. There was no yard waste collection last week. So there's a big combination of people not knowing when collection is and not willing to learn or do anything to collect or pay attention to when collection day is. That's a big part of the problem as well. And which is why I've proposed to you quite a few times, let's work together and try to solve the problem. You feel like I'm asking you to criticize people for what they're putting out. That's not what I'm asking. I'm asking, let's work together to try to educate people, find ways to get information out there so we don't have these problems.
Well, why don't you start sending out a flyer in the mail like you used to and then stick to the schedule on the flyer?
Because the flyers end up everywhere where they're supposed to go, and then they cost $20,000. Recollect costs $7,000, and you can sign up and receive notifications. If I have to change yard waste collection next week, I can send you a notice in 10 seconds, and I can send 4,000 people a notice in 10 seconds saying, next week's yard waste is canceled. I can't do that with a calendar and a flyer.
Well, it shouldn't be canceled. They should be following the schedule. Then you wouldn't have these issues.
If they're on employees, for whatever reason, it happens. For whatever reason, we pay $8,000 a week to collect yard waste. If we can't put 100% into the collection, it's not worth doing it. Yard waste isn't going to hurt anybody out on the street. Trash and recycling, yes. Yeah, is it a pain? Is it a nuisance? There's a big difference.
Well, we just disagree then.
Well, I mean, look, I understand. I'm not fond of these delays either, but there are actions that can be taken to go to the contract, and they're actually more strict than what you're proposing in this petition.
And I would suggest you utilize those.
There's written language, and there's also life and reality. It's as simple as that.
That's all I have.
So I'm going to make a motion that we not change the language that already exists in regard to the contracts for waste hauling. And I will leave it at that.
And I'll second that motion.
I'm in favor.
And I'm in favor too. Jacqueline, I was wondering if I could ask you a question about the Fitchburg Fitchburg University
Yeah.
data that you have. Did you get this off their website?
Off the Fitchburg State website,
Okay.
they have their own COVID dashboard.
Oh, okay. I'll have to look at that.
Well, thank you again for your input and for coming. You do a lot of work on this, we know.
So next is the Title V local upgrade approval on the agenda. I believe Doug Smith, who is the engineer for the proposal for 67 Scott Road, which is actually Sima Park. So if we could let Mr. Smith in on the meeting, he is on virtually.
It'll be a moment.
Didn't make out what he said.
He said it'll be a
Oh,
moment.
there he is.
I
It'll
guess-
just be a moment because I
Thank you,
just
sir.
took note of it. Looks like he's in now.
Yeah,
So,
thank you.
Mr. Smith, can you hear us?
Yes, I am here, yes.
Okay, thank you. If you wouldn't mind, could you just give the board a little bit of an outline on the proposal for the local upgrade approval required for Sima Park? If it's helpful, I can put, actually, I won't put a map on because we don't see you anyway. But in your packet, I did put a small septic plan. I'm looking for the page, I apologize.
You want another
It's
one?
page 16.
Just,
Sorry.
It's page 16 for you septic system experts.
16, did you?
16, yep. So, Mr. Smith, if you wouldn't mind just giving a little, how about a good reason for the request for the local upgrade? How's that?
It's a good place to start.
Yeah.
Yeah, sounds good. We're using a Presby system, and with the regulation with that type of system, you are allowed to go 2 feet lower than the seasonal high. And we had a high water table there, and as it is, it's going to be a very high mound as I've got it designed now. But without that variance, it would be very difficult to get the fill around it. You've got a fence in the front and some different constraints
if you
that
want it.
I'm trying to minimize to make everything fit better.
So as you can see, this is a bird's eye view of, which is Sima Park. So the system before you is proposed right at the front of the property before you reach the existing barn, and then the pavilion that everybody's familiar with is right behind that existing barn. So that barn would tie in, and the system would go towards Scott Road, which is at the bottom of the page. Can't really see it, but. And as Mr. Smith said, there's a large field there. However, the entire field is experiencing very high groundwater. So he proposes to put this EnviroSeptic system in, which allows a reduction of the required 4 feet under the leach field to 2 feet. And the state allows that, provided the Board of Health issues a local upgrade approval allowing the reduction to 2 feet. He did mention a Presby system. Presby is now a brand name of a type of leach field that's very popular, and Presby, very much like EnviroSeptic, provides enough treatment so that that reduction can be made possible. Presby is you do not have to issue a local upgrade approval, if I'm correct on that, correct, Doug?
That is correct, yes.
But the EnviroSeptic still does require a local upgrade approval. Is there a reason from straying from the Presby to the EnviroSeptic, out of curiosity?
I felt this is the best type of system for the area, mainly because of the treatment that it provides. We had a 22-inch water table, and so without this, the system would start off being over 2 feet just to the bed bottom, and then a 2-foot-high system thickness with the cover, so that would be a 4-foot mound. And with this, it will, by the time they put in the sand fill under it, which is 6 inches thick, then the 1 foot of pipe, it's still going to end up being about 30 inches sticking out of the ground, when it's said and done. But with everything I've seen from the soils on that site, it would get proper treatment.
So, go ahead.
All right, go ahead.
So, just so I understand, the leach field, essentially what you're doing is elevating that, is that it? And keeping it out of the water table so the waste doesn't go into the pond and brook that are nearby?
That is correct, yes.
And this just works by some sort of gravity? There's no pumps involved, or?
No, it does have a pump. From the bathrooms this is coming from, it goes into a 1,500-gallon tank first, then a 1,000-gallon pump chamber. And then it's got about 107 feet of piping to get to where the septic is. And right now, the pipe in those bathrooms comes underneath the concrete floor, and so it definitely has to have a pump.
And the idea behind the pump is just to elevate the waste into the elevated septic field, I guess.
That is correct, yes.
Have we got similar experience with this around here, with this system?
I've designed a lot of these in Fitchburg, in Lunenburg, all around. I've been designing them for many years, including the ones in New Hampshire. And they do work very, very well, and they do treat the effluent very well. And that's why DEP put in the regulations that we can get this reduction, because with all the testing that has been done, it's been proven that the bacteria and everything gets treated.
Well, it sounds reasonable to me. I would make a motion that we approve the local upgrade at 67 Scott Road. I suppose, is there a way of kind of confirming the effectiveness of it at some point, or?
So systems require an inspection port. Is that a good way to determine, Doug, that proper treatment is occurring?
Yeah, that would definitely be a way to check it. That could be, it has a screw cap right on top of a ground level, and at any time that can be opened up and it could be looked in to see exactly the level of the effluent. And if anyone ever wanted to do a test from that, that would be a perfect place to get some of the liquid to do that.
I just want to say I applaud the folks from Simon Park. This has been an issue since I started 28 years ago. I never thought I would see this day, so kudos to Simon Park for taking the next step and getting this done. This is wonderful. Hopefully it brings them business and keeps them busy all summer long again. Love to see that place active again.
Super. Well, again, I'll make the motion that we approve the Title V local upgrade for Simon Park, 67 Scott Road.
Second that.
I'm in favor.
So that passes.
Now, who's funding this? Is this the association, Simon Park Association?
I believe so, yes.
That's, yeah, look, that's great.
Nice
That's
group of
a
people.
lot of money for them to come up with.
Yep. So thank you, Doug. I appreciate your input on this.
And thanks.
Yeah, thank you very much. I know this will be a vast improvement of what they have there, so I appreciate everyone's help tonight. Have a good one.
Hope
too,
to get
thanks.
busy. So I think the next thing on the agenda is the AKS recycling. So Mr. Matt Hughes is virtual and will be joining us. So if I may, just let the board know that Mr. Hughes represents AKS Recycling. We've met AKS Recycling on several occasions, as you know. AKS Recycling is proposing to do or accept a new waste. It is our job to determine if the proposal requires a minor or a major modification according to the Department of Environmental Protection. I have devised in our packet starts on page 30. So I will just kind of put a little introduction into it, and then Matt, you can take it over on give us a little insight on the waste proposed. So
Sure.
AKS Recycling obtained a site assignment on January 21st, 2004 to operate a solid waste facility as defined in Mass General Law 111, Section 150A. More specifically, the Municipal Solid Waste Transfer Station on a parcel of land located at 15 to 35 Cobbler Drive and 41 Blueberry Lane in Fitchburg. They propose to accept up to 350 tons of MSW, which is municipal solid waste, and up to 50 tons a day of source-separated recyclables generated by municipalities and private entities in Massachusetts. The site assignment was issued after a positive site suitability report from DEP. In June 6, 2006, this board allowed a major modification of the site assignment to allow AKS to accept up to 250 tons per day and 250 tons per day of C&D, which is construction and demolition waste, for a total of 500 tons per day, after a finding of positive suitability and determination of site suitability by DEP, which occurred on March 17, 2006. Again, in 2008, this board allowed AKS a minor modification to increase its operational hours from 5 a.m. to 5 p.m. on Monday through Fridays and 5 a.m. to noon on Saturdays. On March 2, 2020, this board granted a modification of site assignment to construct equipment to bale and bag MSW and to allow a new process to store baled and bagged municipal solid waste, as you folks remember. Today's meeting is to determine whether the proposal Mr. Hughes is going to present requires a site assignment modification, and if it also does require additional conditions, should they be needed to protect public health, according to 310 CMR 1622, or if the current conditions are adequate to allow the proposal in this hearing become adequate for the Department of Environmental Protection. The meeting minutes would serve as a written approval. So, I have prepared some questions on the next page, which involve the conditions that this board has set since 2004. So I will let Mr. Hughes at this time present what the new proposal is.
All right, thank you, Steve, and good evening. Thank you for your time to let me address you on this issue. We've been approached by a company called Bright Feeds. They're based in Berlin, Connecticut. They have they're looking for a partner in the area around Fitchburg to, what Bright Feeds does is they collect food waste, bread and baked goods from stores, bakeries, what have you, and they bring it to their facility in Connecticut and they process it into animal feed. So it's diverting that material from disposal. It's going back into a beneficial use. So they're looking to expand up in the area. They're looking for a partner to be able to store some material we would just essentially be transferring it. It would be coming in from various locations around the area. They would send a dump trailer to the facility. We would load that material and they would bring it to their facility in Connecticut. It's more economical. It's more sustainable to do it that way versus sending, having a truck go to bakery A, go to Connecticut, come back with the empty container, go to bakery B and just do the same thing. So this, it makes their operation more efficient. So they've approached us to take about 50 to 100 tons a day of material into the facility, into the existing transfer building. We would create a bunker storage inside the building, and then we would load it out. I'm going to share my screen. Oh, I guess I can't share my screen. So all the activity would be, the unloading, the storage, and the loadout would all be done within the existing building where we transfer. Today we're transferring, municipal solid waste, as Steve had described. We're also, we transfer cardboard that we accumulate inside that building, and we would dedicate an area just for that material not for disposal, but for transfer for processing and reuse through their process. Back in August, we approached the board to extend the amount of time we could store municipal solid waste on the tipping floor to match the bale bagging approval that had been done in 2020. This material would be subject to the same time limit of 72 hours. We would rotate the material out and keep that process going. So, again, I'm hoping that we can, within the existing definitions in the site assignment and approved conditions, that we can you can begin doing this process. We've also filed last week a permit modification with the DEP, a new waistband plan to account for this specific activity. We've had extensive discussions with the DEP on this, as has Bright Feeds, and also they reached out to Mr. Curry to talk about what we were looking to do, and that they approved it, or they're in favor of us proceeding. They just need to figure out a way to regulatorily make it go. I can share my screen now. I'm going to put the site map up here. Can everybody see this?
Yes, now we can.
Okay, so here's Blueberry Lane. This is the existing facility as it is today. So the trucks would come in the inbound scale. This is how trash and other waste trucks travel today. So it's going to be the same process. They would come into the building, back into this is where the new bunker would be that we would create. Mostly MSW is sort of accumulated in here and loaded out with trucks. And then we also accumulate cardboard on this side of the building. But there would be a block wall established right here. And to prevent any sort of, in case you have some wet trash or a lot of rain, we would have a berm here to prevent any liquid from coming into this and somehow contaminating the bread waste. So it would be accumulated in this location. Again, it's within the existing footprint of the building. Towards the end of the day, the plan would be to have a truck come from Bright Feeds, and we would load it, bring the truck inside the building, load the material inside the building, bring it outside, cover it, and then it would proceed to the outbound scale. So we'd weigh the truck in, weigh the truck up, and that's how we'd know, what was being shipped. So that's kind of it in a nutshell. I don't know if I've missed any important points or if you have any questions at this point.
So I think you may have answered number one. You said 50 to 100 tons per day of this material?
That's correct. That's what they're proposing right now. And this would all be coming in within the approved 500 ton a day limit at the facility.
Okay,
So that answers that question.
one, yeah. I have a question that I haven't had a chance to read all these, but would this food material be coming, where does it come from? What kind of radius from here?
I'm not sure what their radius would be. That they would have to figure out what, how far from AKS that they could go. But we looked at our facility in Millbury. We have a transfer station there. for a few reasons, it didn't work out. This one, AKS seems to be a little more central to their targeting, trying to get new customers, and they'll have to figure out how far, what radius service area they want to establish. We're giving them space on our floor to do that process to make it again more efficient for their operation in Connecticut. And there's also other places that might go. They sort of gave off. There's a facility in Pennsylvania. There's a facility in Quebec, and there's one in Perth Amboy, New Jersey, that are options as destinations as we load the material out. So it isn't. So if they have an issue at their facility in Connecticut, there's still 3 other places they could potentially deliver that material to, have it processed into the animal feed.
Mr. Hughes, do you know how the material is transported and what type of vehicles?
Yeah, it'll be a dump trailer. So probably an aluminum dump trailer that has got a retractable cover on it. So a tractor trailer unit with a dump trailer. It's a common trailer.
So one of our conditions would be that the vehicles do not have the potential to litter the streets or during transport. So that's kind of question number 3.
So it's a sealed unit once the cover is on.
Yep.
Yeah,
So littering would not be a problem, it sounds like.
correct. Right. And plus, everything would be done inside the building. No handling of waste outside.
That's question number 2. No, none of this material will be stored on the outside of the transfer station.
Correct.
So does the material have the potential, one of the conditions is concerning dust. Is there any potential for dust in transport or when it's placed on the tip floor?
What I've been told is I don't think there's a potential for dust. I mean, it's bread. You're going to have some that's going to be, in packaging. So you have that. It isn't like we're getting loads of flour. But if we have, if needed, we have the misting system that we could use if there's a dust issue. And also, if there's an odor issue, that's probably one of your questions as well. We can address both of those items with the misting system that's installed.
So one of the conditions is relates to obviously vermin. What's AKS plan to continue to comply with the requirements for limiting birds, rats, rodents, insects?
So we have a exterminator service that we would use. We would monitor that with our staff, and if there's issues, as you outlined in the site assignment, if we have to address the issue accordingly, we will do that.
So another condition is that material is not allowed to remain on the tip floor longer than 72 hours. Will this material be on the tip floor for more than 72 hours?
The objective is to comply with the 72-hour limitation. So the material will be moved out within that 72-hour period, rotated through.
Condition number 6 of the site assignment limits the amount of roll-offs on the site. I know this really doesn't pertain to AKS, it was more the previous owner, but will this material increase roll-offs on the site?
No. So the material would come in, so you picture like a typical compactor box at, say, a grocery store. Bright Feeds would go to that site, pick up that container, bring it to AKS, dump it, and it would return back to the location it came from. They would not be leaving any roll-offs on our site, empty or full.
A roll-off being an empty container, is that it, or what is a roll-off exactly?
Yeah, it's a roll-off is a dumpster, and the previous owner of AKS also had a trash business where the city tried to limit the amount of empty roll-offs that were stored on the site to 60 is the actual number. And that condition actually still exists, so it's just seeking compliance by questioning.
So essentially, you'd just be dumping the food and taking the roll-off back? Wouldn't stay
Correct.
there? Yeah.
Yep.
So is this material considered MSW or recycling?
Well, I mean, it's municipal solid waste, and it's like we have, when you have loads of waste with cardboard, we can pull the cardboard out and that gets recycled. It's one of the issues we had to work out with the DEP is what to call the material. It is it's within the MSW definition, but it is a recyclable material.
A little of both.
It is a little of both. It's kind of in that area, and we're kind of the first solid waste facility in Massachusetts to look at doing this particular process. And like I said, we spent time with DEP walking through the applications, how they would want it to be written, and then get it to approval. So we've been working with the high levels in the central region at DEP to get this to go through. They support it, and we're trying to help that along with what we're doing tonight.
So one of the conditions relates to truck backups. I don't see 50 to 100 tons per day, but would there be, as a result of accepting this material, truck backups and anti-idling violations?
I don't see that. I mean, you're talking. It's not going to add to the amount of time.
Yep.
It's going to unload very quickly, just like a regular trash compactor would unload. It's in the load out process will be towards the end of the day when traffic is lowest. So it's kind of a coordination, and we can dump at the same time. We could dump a load of MSW on the other side of the transfer station, as well as unload the bread waste in the bunker. So we're not going to be hindering any sort of flow of traffic.
So will the hours of operation change as a result of taking this material?
No.
Does the material have the potential to create odors? And if so, how will AKS prevent odors?
So moving the material through on a timely basis is the number one way to avoid any sort of odors. If we did have an issue, like I mentioned previously, we do have the misting system. We'll have the capability to add odor counteractant to it, but that's the backup plan. The primary plan is to keep the material moving, much like we do with the MSW that we accept right now. And we've not had odor issues since I've been associated with the facility.
Is there any liquid as a result of any liquids created as a result of storing the materials on the tip floor?
I'm told by Bright Feeds that the material we're going to get is not going to create a liquid issue. It's not like getting produce where you could have that potential. There's no vegetative material associated with this. It's all baked goods and bread.
Does it come bundled up, by the way, or is it just loaves of bread that are free?
I think a little bit of both, a little bit of everything. So they did mention, you could get, it could be a bunch of small, tabletop pies, for example, that are just expired. So they have, on their end, they have a depackaging operation. So there wouldn't be any depackaging or other handling of the material when it's on site. It would just be put in the bunker, staged there, and then loaded out, and they would do whatever they have to do on their end to get it through their process.
So this waste would not affect your wastewater discharge permit?
No.
And then does the material present, and one of the conditions protects the employees of AKS. So does the material present any dangers to the employees of AKS or create any OSHA violations?
No. It's going to be, the same basic PPE that we have our employees wear is going to be sufficient for, when this material is on site.
Will this operation proposed require an authorization to operate from DEP?
So we are modifying our authorization to operate right now with a modified waste ban plan, as well as through an SW45 permit modification, which we've submitted the same description that I had provided to you. That's part of this. That application was submitted and it describes the operation just as we're describing it here. So yes.
And then the whole reason why we're here, the $10,000 question is, does the proposed material in any way a potential threat to public health?
No.
Long question, short answer.
Yeah.
I didn't hear what was said about the odor problem, how they would handle that.
I think he said just by getting the materials out pretty
and
quickly
out.
so they
In
don't
and out.
sit. And
Just
then they
like
have
trash. As long as it doesn't sit there, it doesn't have time
What if
to.
it does, though?
Yes, they have a misting system, he said, with
Correct.
they
Wouldn't
can,
that make it soupy?
Well, he can't. So he would be in violation, or AKS would be in violation if material were found to be there more than 72 hours. But think again, they're a transfer station, so if they're not transferring, they're not making money. So it's not,
I
it
couldn't
doesn't,
hear.
it doesn't
Sorry.
benefit them for material to sit around.
Okay,
That's
thank
right.
you. Thank you.
just, since the tonnage is going to remain the same, is it going to change the contract with the city at all, other than any potential modifications? I mean, from a financial standpoint, or that all remains the same?
That would remain the same, yeah.
Yeah, I would agree with that.
So it's,
Did you, Jacqueline, did you have a question with regard to this, or?
Yeah, I was just curious, these baked goods and bread, are they rotten that you're throwing them out? Why wouldn't you give them to, like a food bank? I know my mother's been working with a hoarder and who has food that's really, really old, and there's one place in Clinton that will take things that are up to 2 years past their expiration date. I would think you could maybe do something instead of just throw it out.
Well, again, all we're doing is providing a location for this material to be accumulated so that Bright Feeds can take it to their facility, and they don't, it's getting reused as animal feed. The reasons why they're not being sent to locations that you would mention, we're not into that part of it. We're just providing a location for material to be accumulated and then transferred to Connecticut or other locations as they see fit.
Right.
so technically, it's coming out of the waste stream. It's being thrown out. Now it's not going to be thrown out. It's going to serve a new purpose as feed.
That's right.
Or who?
Which meets the goal of the State Department of Environmental Protection, is they're trying to get food waste out of the waste stream. So this is sort of encouraged by the state.
So they're going to use it for feed, you said?
Feed, yeah.
Or what, animals?
Yes.
What kind of animals?
Cows, pigs, that's,
Never mind.
Two-legged and four-legged.
I don't know if I want to know. You mean, if it's not good enough for us to eat, I guess, I don't know. Okay, forget it. Wait.
So it's really up to this board whether a minor modification is required. If this board does not feel that the conditions, the 38 conditions that we have in place from 2004, and that public health would be affected by this proposal, then we would force AKS to go to a site assignment, which involves hearings, and they would need to present how they intend to protect public health. This is more of it is a food waste, so it does obviously attract vermin.
Seagulls.
But again, they are a transfer station, so if they're not transferring, they're not making money. So the incentive is to move materials.
in a way, they are making a site modification that they're building a bunker, is that right? That's going to be pretty much impervious to these critters.
It's a sort of a three-walled approach. So
Right.
it's in their portable concrete blocks. We're not pouring foundations and creating permanent walls. There's an existing steel plate wall on the back side of the facility. There's a existing wall at the front where the entrance is, and then we would put this block wall. I'll share my screen again. So it would be this is an existing wall. This is an existing wall, and we would be just adding a 2 or 3 high concrete block, we can move it back and forth as we need to, depending on storage space that's necessary for storing material here, or if we have a lot of MSW, we can move this around. So it's not a fixed structure, not a fixed modification that we're making here.
I see.
So page 32 of your packet points out modifications, if you're interested in. I can read it really quickly. It says, any request to modify a site assignment that is not subject to 310 CMR 1622, including any request to modify conditions established by the Board of Health in the site assignment or to increase daily or annual tonnage limits, except specified in 1622, are deemed to be minor modifications. The Board of Health may modify a site assignment to address a minor modification at the request of the facility owner or operator, without requiring the filing of a new application by the applicant or site suitability report by the department, provided the Board of Health provides public notice and holds a public hearing in accordance with the requirements of 310-16. So it's up to this board to decide whether a modification of the present site assignment conditions is necessary.
Or if it's a
Or if
minor
it seems like it fits in the present operation and they continue to comply with our site assignment conditions, this meeting can serve as that. Public hearing. It doesn't seem like it's a large change. Maybe, like we have done in the past, maybe we set a, don't term it a minor modification, but maybe we give them a trial period and then come back to us and report in a period of time how things are going, and we can discuss it then. But it doesn't seem like a minor modification is necessary according to the regulation. There's no increase of tonnage, and there's really not a large amount of construction to accept the waste or a lot of change in the operation. So it seems.
And they're still within that 72-hour requirement to get things out. So I would agree. I think I favor what you just said, and that is that we let them go ahead and do this and perhaps report back in 6 months or so just to let us know how things are going. He looks honest.
Thank you.
I mean, I can see the winter months being okay because it's cold, but what about a hot spell in the summer when there's a lot of humidity? That stuff's gonna smell like heck.
Well, I mean, we like Steve says, we deal with a lot of trash in the summertime, and we've not had any issues, and we want to get the material.
That's the only thing that I can think of.
Yeah.
I don't think it smells any worse than the trash they take.
Yeah.
Well, in a
But
hot,
it-
humid day, it might be
I
pretty
like-
ripe down there.
I like the idea of revisiting in 6 months. That'll capture some of
Yeah,
the
yeah.
the hotter weather.
Okay, I agree to that.
Does you-
Make a motion?
Yeah, if you're acceptable to that, a motion would,
Yes, I'll
Makes
make a
sense.
motion that we accept the proposals to store bread and baked goods on the tip floor inside the facility as outlined in the application.
and that a minor modification is, at this time, is not necessary.
It's not necessary, no.
Minutes to this meeting will serve as a approval to the Department of
Yes,
Environmental
it will,
Protection.
yes.
Well,
I second
All
that.
that, Karen?
I second.
It's kind of a crappy motion, but
and I'm in favor as well.
we approve that.
Well, thank you.
Thanks very much.
Thank you, Mr. Hughes. We'll be in touch.
Thank you, Mr. Curry. Have a good night, all. Thank you.
You as well. Those are complicated. Sorry.
Well, it seems we're fortunate to have people who are fairly conscientious about the work they do, and so
I'd like to go down and visit that place sometime.
Absolutely,
I
I would
really would.
encourage it.
I'd like to go down there on a relatively warm,
I would
humid
love to have
day.
us.
Huh?
So we do inspections, and they'd love to have us.
Yeah, I would. I'll wear my
You
boots.
let me know,
and-
bring your boots and look at
Yes,
that.
definitely wear my garden boots out there.
You let me know when you want to visit.
Well, in the summer.
Summer's the best time.
Yeah, I
That's,
don't want to, it's too cold
that's when
right
things
now.
are the most interesting. So you want to talk about your proposal?
Yeah, so this next item, Board of Health meeting rules, discussion and vote on the following rules. I was kind of looking at the city council's agenda format a couple of weeks ago, and they have this clause on all of their agendas, okay? And I thought, well, why shouldn't we have it on ours? It's just a, yeah, it says, opportunities, it has to do with opportunities for the public to speak during a Board of Health meeting. And it says the chairman will ask if anyone in the audience wishes to speak before each meeting on anything that appears on the agenda. And if you wish to address the board, you, pretty much like what we do now when Jacqueline and other people come, you must stand and be recognized and follow these rules before speaking. State your name and address. I mean, we had to do this in the city council when you and I, when all of us went up there.
Yeah.
Okay, we should have them approach the center table and stand or sit. This allows you to be seen and heard clearly by everyone in attendance. And we can, you may speak only on items appearing on the agenda for no more than 2 minutes. This keeps us in line with the open meeting law. Please state the petition, order, ordinance, or resolution number you wish to refer. I don't believe this refers to a hearing, okay? It just refers to petitions and other items on the agenda, correct?
That's correct.
Right. So, I mean, doesn't it mean that at the end of 2 minutes, we have to go handcuff the person and bang the gavel? But, you know, if things get out of hand, then we can refer back to this. It's,
So I know the $10,000 question, and the elephant in the room is the address issue.
what do you mean, the address?
And number one, it says state your name and address.
Oh, you believe that's
is-
personal information that would be revealed, or?
Yeah. Is there, is a resident of Fitchburg, Mass. adequate enough
Yeah.
to,
Yeah, we don't need to know their address, but their name, we need the name for the minutes anyway, so.
correct?
But we should know that they're from Fitchburg.
So an accepted answer to the address would be a resident of Fitchburg, Mass.
Yeah, I would
Yep.
definitely agree with that.
I have a question, one other question. Would the petitioner be allowed to speak longer than 2 minutes? I know Ms. Wetchy, I wouldn't want to limit her to 2 minutes with some of these things she's brought in.
Right. Yeah, I don't think we have to stick to the, I think, yeah, we definitely should go, we could go longer than 2 minutes, but in some cases, we may have to limit it to 2 minutes. Does that make any sense? I mean, the city council is very strict about this, and they stick to this.
Should we say, you may speak only on items appearing on the agenda for more than 2 minutes unless allowed by the chairman of the meeting?
Very nice. Very nice.
Makes sense.
So if things are out of hand, you don't have to.
Right. I mean,
Ms. Wetchy has a question.
Jacqueline?
Yeah, I just want to reinforce what Mr. Curry said about a person should be able to just say that they're a city resident and not give their address. The Secretary of State, Bill Galvin, has a whole program to hide people's addresses if they're victims of crime. Also, there are people who may feel stigmatized if they don't have an address, if they're homeless, but their primary place that they stay is in the city. We're on television. If you give your address, then, you know,
Yes.
some
you're right.
criminal
You're
could say
100%
you're
right.
not home, I'm going to go rob you because you're at the Board of Health meeting. It's far-fetched, but you never know. I just think it's better to not get that specific.
I agree.
So just name then is enough.
Just name and resident of Fitchburg.
Or if you're not a resident, what your purpose in the meeting is, like you had, this guy here from AKS, he must, probably not a Fitchburg resident, but he's got a legitimate reason to be speaking to the meeting.
Right. Should we make a motion to approve?
Yeah, unless you have anything more to discuss about whatever this says or change, or whether you don't feel like it's necessary or you do, or.
I think now that we're in this building and we're on FATV, and
We're getting
we actually have the room to have a forum, and we might get more people showing up. I think it makes sense to have some
Yeah.
rules.
So I make a motion that we accept this clause to be placed on our agenda, on every agenda prior to our meeting. Period.
I'll second that.
I'm in favor, as long as it reflects those changes that we,
Yeah, reflecting
spoke
that,
about.
that no address be
Right.
just name and purpose of sending, I guess.
Okay, so just state your name and number one.
Yeah.
Okay.
Name and that you're a resident of Fitchburg, right?
Yeah, yes. Well, I had written down purpose of, I guess, I don't know why I wrote that. Never mind.
Yeah, purpose is actually number 4, right? Or 3?
Yeah.
3 and 4.
State the petitions, because it has to be on the agenda, right? We can't go off what the agenda says.
Right.
Okay, name and if resident. I make a motion to adjourn.
Just before we do that,
Oh, okay.
just one question. There, I think in the last few days, we were going back and forth about a request that Applewild School had made. How's that going to be dealt with?
So I want to be clear exactly what the applicant wants to vary. I don't foresee it being a problem, and I apologize, I forgot about it, that we could have taken care of that on this agenda, but since it was already posted, I did ask the applicant if our next meeting was acceptable, and if it didn't affect her construction in any way, and she said the January meeting was fine.
Yeah.
I just want to have her put in writing exactly the code she would like to vary, so that we make sure that we meet her needs. But doesn't sound like a
No, apparently it has to do with the type of furniture that
Right.
goes into a dormitory or something.
and maybe it's a good time to look at that regulation, see where, if that is really necessary. I know in 2011, when the lodging house regulations were adopted, there was a goal and a push at the time around the college area to develop student housing, and they actually rezoned the area to encourage student housing. And we did get a few large facilities turned into student housing, but we kind of adopted regulations geared towards that at the time, and
Yeah, I think it's
may not
just,
quite fit every
these are going to be young kids, you know,
yeah.
so they don't need...
I don't think that thought process was there. It was more geared towards the college area.
Right. Okay, great. Sounds wonderful. All right, we'll entertain...
Now, make a motion to adjourn. Not that I'm in any hurry, but
Chilly enough?
I'm freezing.
Will the next meeting be the first Thursday in
Thank you
January?
for asking. Thank you for asking.
It will be, yes.
Yes?
Pretty sure. Yeah, it's chilly in here.
Yes, it is.
Freezing.
So it looks like the first Thursday would be January 6th.
Fine with me.
Is that a go?
Yep.
Okay, now you may adjourn.
Make a motion to adjourn.
I second.
Favor.